Hello, Giving Circle. I'd like to start this presentation by thanking you for the opportunity to share our project proposal with you, as well as your dedication and commitment to the Miami Women's Initiatives. The title of our project is Mindstrong, using cognitive behavioral therapy to increase emotional intelligence and decrease stress, anxiety, and depression in nursing students. My name is Tricia Neu, and I am an assistant professor in the Department of Nursing, as well as a practicing family nurse practitioner. In both my roles, I have noted the alarming trend of crippling anxiety and depression among the college-age population. This is mainly due to their inability to manage the stressors that are associated with college and entry into the workforce. This is especially prevalent among our nursing students who are predominantly female. Nursing students are required to pass very high-stakes exams throughout their curriculum, and then upon graduation they are required to pass a high-stakes exam in order to gain licensure, and then once they are licensed, will practice in a high-stakes clinical setting. All of this is very anxiety-provoking, and for this reason, I, along with a colleague in the nursing department, have decided to implement Mindstrong. Mindstrong is a cognitive skills building program. It is a program that lasts 7 weeks, and it is highly evidence-based. It utilizes cognitive behavioral therapy principles to encourage participants to evaluate their thinking patterns and their emotional responses to their thinking patterns. For those of you who are unfamiliar with cognitive behavioral therapy, the premise behind this approach is that how one thinks affects how one feels, which in turn affects how one behaves. And so through Mindstrong, the goal is that the participants will be able to replace negative thinking patterns with positive thinking patterns, thus producing positive feelings and positive behaviors. Because our participants will be evaluating their thought processes and their emotional responses to these thought processes, we would anticipate that their emotional intelligence levels will also be enhanced through this process. We plan to study the effects of this program by evaluating baseline emotional intelligence, depression, and anxiety levels, and then comparing them to post-intervention levels. And if this program is successful, we would like to evaluate the possibility of implementing this program into our curriculum at Miami University. And I want to leave you with this one thought. As we are currently in this pandemic and our healthcare workers are struggling for personal protective equipment, how are we arming them with the ability to manage the stress that they are currently experiencing, not only now in this pandemic, but every day in the clinical setting? We hope that Mindstrong will give our students the tools that they need to manage these stressors and bring better care to the bedside. Thank you for your time and attention in this matter.